The common symptoms of nasal polyps is nasal obstruction. You can't breathe through your nose. Nasal congestion, the nose isn't just blocked, but it's sensitive, it hurts, it drips a little bit. Anosmia, or a poor sense of smell or a lack of smell, or the wrong sense of smell. Only the top 10% of the nose has smell fibers, so if the lower part of the nose is blocked or inflamed or congested, your sense of smell will be affected. And then there are other related symptoms, whether it's facial pressure or a runny nose can also be a sign of nasal polyps. Well, the larger the nasal polyp, the more the nose is going to be blocked. Sometimes it may be larger on one side versus the other. The patient comes in and says, I'm blocked on the left side. You look in and you see polyps on both sides. Conceptually, I'd rather see them on both sides because that tends to be a benign polyp. One-sided polyps may have other etiologies or causes. And small polyps can go for a long period of time without the patient knowing it. And normally these people will have what they would call recurrent colds or recurrent sinus infections and not appreciate the fact that they've now gone from chronic sinusitis to chronic sinusitis with nasal polyps. Think about waking up every day and you can't breathe, sitting down for dinner and not being able to smell or taste what you're eating. Think of having a cold all the time. This is something that's very unpleasant. We can tolerate it for a week or 2 or 3 weeks, but beyond that, most people are uncomfortable. And with nasal polyps, this can go on for a year, 2 years. People come in and I ask them how long they've had it. It's really quite remarkable and they're very uncomfortable. If you have nasal polyps, you want to go see a doctor so you can get treated right away to make a diagnosis. There's also an allergy component or a fungal component. Some of these are driven obviously by your environment. And if you can change your environment, you may be able to make the nose do better and have the polyp shrink. But it all starts with a good exam by a physician, particularly an ear, nose, and throat doctor, to look in the nose.